Hi, welcome to the Medicare Show. I'm your host and Medicare advisor, Jeffrey Kuhn. This is going to be the last episode, most likely, for 2024. And this is an item I get called a lot on, something you probably received in the mail if you're on Medicare. And it's a subject I've covered before, the Medicare Prescription Payment Program for 2025. Everybody's gotten sheets in the mail from your insurance company asking, here's some estimates, examples of costs and how it works. I'm going to give you a summary. Should it be something you should consider? If it's not, I'm going to tell you right away to ignore it and why. But the sheet's a little bit confusing because they give you several examples. I'm just going to tell you the bottom line, what you need to consider with this. In the prior videos, I've shared with you that the Medicare Prescription Payment Program really is designed to smooth out your costs for your medications for 2025. And your out-of-pocket costs for your prescription should be capped at $2,000. So if you've got a deductible on any Tier 3 medications, it kind of averages that out over the year. Do you have to sign up for this in January, or with the sheet you get? You don't. You can enroll in it later. Now, the information that I share with my clients is this. First of all, if you don't have prescriptions or you've got very inexpensive prescriptions that either have no cost, your Tier 1s, or Tier 2, some of them have low copays, I really wouldn't worry about it. It's probably more trouble than it's worth. Just pay your copays when you get them filled. For a lot of people that get your prescriptions filled with a copay, you want to be conscious if you've got discounts when you get 90-day fills. Because when you get your prescriptions filled for 90 days, typically you're offered some sort of discounting in that. So something you want to consider. I would not enroll in this, again, if you've got Tier 1s or 2s. It just doesn't make sense. Pay the cost of your prescriptions when you pick them up and don't worry about it. For everybody else, you don't get discounts with the cost of your drugs for the year for the $2,000 out-of-pocket max by enrolling in this is the plan's designed. It's not meant to discount your drugs. However, it does have a very profound impact on what you may pay over the course of the year. I've done a very, very in-depth analysis on this for a lot of clients. I've looked at this, and what I found is some plans, there's a huge difference. And I will tell you the same prescriptions with one company might amount to a $600 rough, I'm rounding here, out-of-pocket max for the year, where another company you could be at the full $2,000, depending how that drug is structured in formularies, because there are some prescriptions that are Tier 3s with one company, and they might be a Tier 4 with another. The discounting that's available with 90 days, or some insurance companies that will give you a month for free when you do a 90-day. You pay for 2 months, you get the third for free. There's a crediting that happens when you get those prescriptions filled. So for some clients, you might only pay out if you design this optimally. And I've had clients in some very expensive prescriptions that are Tier 3s that are pretty common, and they're going to pay out maybe about $600 for the year. They're going to hit their $2,000 out-of-pocket max because of the troop expenses at Medicare, and that's really just how they calculate it. Does that make sense? Well, they might pay $50-some a month for their prescriptions. If you've got, and there's clients that are on prescriptions for Crohn's disease and different things that are very, very expensive, and you're going to hit your $2,000 out-of-pocket max, the most you're going to pay is $167 a month for your prescriptions. That includes everything, assuming that it's in formulary. If you're in that category where you're going to hit that out-of-pocket max right away in the first quarter, even the second quarter, it probably makes sense for you to consider that. I would definitely call your Medicare advisor, whoever you're working with, and ask them, what is my monthly cost going to be for these prescriptions if I do the Medicare Prescription Payment Program? They should be able to answer that question for you. They should know what prescriptions you're taking. They should know where you're getting them. And have they looked at and said, what's one company over the other? Because it does make a big difference. We found that going into 25, it was a big, big part of a decision-making process, because that for some people was a determining factor which company they were going to go with. When we got down to the two best, it sometimes came down to the prescriptions. even though there's other things that they like benefit-wise with the other company, it made a big difference in how much they were going to pay out of pocket. And we're talking excess of $1,000 difference for the same exact drug. So the Medicare Prescription Payment Program, you don't have to sign up for it. Again, if you've never hit the donut hole, probably doesn't make sense, something to consider, but talk to your Medicare advisor. But those are what those sheets are. Just very confusing examples. I've looked at it. I've had clients bring them in. We sat down on my conference room table and just looking at it, I remember the first time I go, this is not easy to understand. If you have any questions about it, you've got those sheets, or if you want us to take a look at it, again, feel free to reach out to us. Our information should be below. If you'd like us to really look at any specific prescriptions, shoot us a comment. Let us know. But if you'd like this, please subscribe to the channel. Share it with somebody you might know that needs help with prescriptions or has questions about it. And again, if you've got any more questions, please comment and I'll be happy to answer them. Thanks so much for joining me. Hope you have a great end of your year. Bye-bye.